Several persistent myths about home physiotherapy are preventing people who would benefit significantly from ever considering it. Let me address the most common misconceptions with the actual clinical picture. Myth 1. Home physiotherapy is only for elderly or housebound patients. This is the most widespread misunderstanding about home physiotherapy, and it is completely incorrect. Home physiotherapy is appropriate for any patient for whom in-home assessment and treatment provides a clinical advantage over clinic-based care. That includes post-surgical patients in the early recovery weeks, where the home environment is the functional context for rehabilitation, and treating in that context produces directly applicable outcomes. It includes parents of young children who cannot reliably attend clinic appointments, for whom attendance consistency, the strongest predictor of rehabilitation outcomes, is only achievable if the treatment comes to them. It includes athletes who want the physiotherapist to see and optimize their home exercise environment, their training space, and the specific conditions in which their program will be performed. It includes patients with chronic conditions who benefit from periodic home visits that assess how their functional environment has changed as their condition progresses. Myth 2. Home physiotherapy is not as clinically thorough as clinic treatment. The clinical assessment in a home visit is identical to a clinic assessment in scope, the same detailed history, the same range of motion and strength testing, the same special tests and neurological screening. What the home assessment adds is ecological validity. The physiotherapist observes your functional challenges in the actual context where they occur. This produces specific, actionable clinical insights that clinic-based assessment cannot replicate regardless of its quality. Myth 3. Home physiotherapy costs significantly more. The price difference between home and clinic physiotherapy in Malaysia typically reflects the travel component, approximately 20 to 50 ringgit per session, more than an equivalent clinic visit. For patients who would otherwise miss clinic appointments due to transport, parking, or time constraints, the difference in out-of-pocket cost is negligible compared to the clinical and economic costs of completing 50% of a rehabilitation program instead of 100%. Incomplete rehabilitation is a significant driver of re-injury and the transition to chronic pain. Myth 4. You cannot do proper exercises at home. The majority of evidence-based physiotherapy exercises for musculoskeletal conditions require no specialist equipment. Pelvic tilts, bridges, bird dogs, dead bugs, clamshells, sideline hip strengthening, proprioceptive progressions, and progressive functional loading from beginner to intermediate difficulty all require a mat, a firm surface, and occasionally a resistance band. A physiotherapist conducting a home visit identifies what basic equipment would extend the program meaningfully, and many bring resistance bands and foam rollers for the first session until the patient sources their own. Myth 5. Home physiotherapy is primarily relevant outside urban centers. In practice, the highest utilization of home physiotherapy services in Malaysia is in urban centers: Kuala Lumpur, Petaling Jaya, Subang Jaya, Penang, where the combination of traffic, parking costs, and work schedule constraints makes consistent clinic attendance the more difficult option for many working patients. Accessibility is a relative concept. A clinic 50 minutes away that you attend consistently every week is accessible. A clinic 40 minutes away in traffic that you attend sporadically is not, regardless of its clinical quality. For post-surgical conditions including knee and hip replacement, randomized trials consistently show equivalent 12-week functional outcomes between home and clinic-based rehabilitation. Post-surgical home patients typically return to domestic functional independence earlier because rehabilitation occurs in the exact environment where that independence is needed. The clinical research case for home physiotherapy is no longer simply that it is convenient. It is that for the right presentations, it is the superior delivery model. The evidence for home physiotherapy outcomes consistently shows equivalence to clinic-based care across post-surgical, chronic, and acute musculoskeletal presentations. Patient satisfaction rates in home physiotherapy populations are consistently above 85% in the published literature, among the highest of any physiotherapy delivery model. The full information about home physiotherapy services, coverage areas, and how to arrange a first visit is in the link in the description.